Health Spotlight, presented by Community Health Network.
Turning now to our health spotlight and the fight against COVID-19. According to a new report, the pandemic most likely came from a laboratory leak in China. Officials have been divided over how the virus began in 2019. I do want to bring in Wish TV medical expert and former U.S. Surgeon General Dr. Jerome Adams. You were in the White House when the pandemic started. Are you surprised by the Department of Energy's report?
Well, it's important for people to understand that the Biden administration asked multiple different agencies to look into the origins of the virus, and 4 different agencies said that they thought it occurred naturally. One agency, the FBI, said that they thought there was moderate evidence that it occurred from a lab leak. And previously, the Department of Energy, which is the department we're talking about here right now, the agency in question, said that they couldn't decide. So recently, the Department of Energy weighed in and revised their report from inconclusive to them saying that they feel that it was most likely from a lab leak. But again, they've said that with low confidence. So I'm not surprised. It's not as big of a deal as people are making it out to be, because you still don't have anything conclusive, no smoking gun. But I am surprised that the Biden administration didn't publicize this more. It wasn't talked about.
Can you clarify what that low confidence statement means? Why are they still not sure, and will they ever be?
And again, great question here. You basically have 3 choices. You can either say, I think it came from a lab, I think it occurred naturally, or I don't know. And what these agencies have done is weigh in on one side or the other. But they've also said, hey, we think there's high confidence in this, or there's low confidence. So what they're saying is, again, there's no smoking gun. They don't have any conclusive evidence. But when they look at different factors like the genetic makeup of the virus and the timing and different aspects of information that they have, that they feel that it's low confidence. But if they had to choose, they would say from the Department of Energy standpoint that they think it occurred from a lab leak.
So does knowing the source change how one fights the virus, or is it just knowing what happened and how to stop it?
Well, one of my frustrations has constantly been this obsession over the source of the virus, while ignoring the fact that regardless of where it came from, China did not give us the information we needed. You mentioned I was in the room. I was frustrated, as was the entire administration, from the lack of transparency on the part of China, no matter where this virus came from. They weren't telling us symptoms, they weren't telling us how it was spread, and they certainly weren't giving us information about origins. And so I think we need to focus more on making sure that WHO, the World Health Organization, and other international entities hold China accountable and make sure the next time around we can get the information we need to protect ourselves. That's more important than figuring out whether this came from a lab leak, this particular virus, or not.
Well, and this time around, people are still getting sick. So sticking with this topic, the FDA authorized the first at-home test that you can now detect both flu and COVID-19. How does this help track COVID?
Well, it's been a long time coming. And as you remember, we had the triple-demic in this most recent winter, the last couple of months, of RSV, of flu, and of COVID. So if you had a cough, if you had a fever, you didn't know what was going on. And this is one more tool that we have available to be able to make smarter decisions about, should we isolate? Should we take medications like Paxlovid or Tamiflu? And should we go in to see a doctor? So I think it's a step in the right direction. It's a long time coming, and I think it'll help people better track their own personal sicknesses. It's not going to do a good job of helping us track COVID on a broader scale because, again, most people aren't going to report the results of this test.
Well, and with the few seconds we have left, the accuracy. You have people who aren't trained conducting the testing.
Well, and that's what the FDA looks at when they're doing at-home testing. So 88.3% of COVID infections were detected, 90.1% of influenza A infections. And this was in an environment where people were doing it at home down to the age of about 14 years old. So I think you'll get pretty accurate results, and I think it'll help people make smarter decisions about how to protect themselves and others.
All right, Dr. Adams, thanks for weighing in on this Monday.
Absolutely. Thank you, Drew.